I'm Lan Merrill from Thousand Oaks, California, and I was a gymnast back when I was younger, not a very good one, and when I was 17 I broke both of my knees with a gymnastics accident. I crawled off the mat and was on crutches for 6 weeks. About 6 years later both my knees failed, and so I had to have arthroscopic surgery. And at the time, back in, I guess this was in '84, they would literally cut away the torn parts of the cartilage, and that was it. That was the treatment. Well, fast forward now 20 or 30 years, and I have no cartilage left on the inside of both of my knees. So the pain was getting to the point I could barely walk, which is not good for somebody who's 55 years old. And my Kaiser docs, God bless them, I'd go in there and the ortho would look at my x-rays and say, "Lan, you have the knees of a 90-year-old man. When would you like to schedule your knee replacement?" And 55 years old, I know as well as everybody else that these things have a lifespan of 10 to 15 years, best case, and the failure rate after the second replacement is incredibly high. And so I just said, "Hey doc, that would be never that you can schedule these replacements. I don't care, you can, I'll crawl out of here before I'm going to have you guys put in knees." So my wife is like the most amazing lady that just is totally into really interesting kind of treatments and stuff. She's just been on the bandwagon for all kinds of great stuff for years. And she found Dr. Yu's thing, I think, in the LA Times. And honestly, I'm a real skeptic, and I looked at it and I went, "Yeah, right, voodoo." But I got to tell you what, after 6 treatments, things are noticeably better, to the extent that I would have to say that the steps that I take, there are two series of 4 steps to come up into the Dr. Yu's office. And from the parking structure up to 2 levels of steps, noticeably different in 3 weeks. And no, I'm not getting paid to say this. We'll talk about that in a minute, depending how much more you want.
Once you work here, you're the cameraman, right?
Yeah. No, I spent 30 years not being in front of the camera, so that's what my specialty is. But anyway, are we still talking?
Yeah.
Oh, all right. So anyway, I'm a believer. One of the things that I was talking to all the guys here that do the therapy is that every time I came in here, Dr. Phil had another piece of equipment that I hadn't seen before. And so I walk in here, I'm kind of a tech guy anyway, and I'm like, "Ooh, what's that?" And so there's always some new fancy gadget. He's got magnets.
I'm going to introduce you to our next one.
He's got lasers, and he's got all of this wacky stuff going on. I'm just going, you know what? Bring it on. And I have to tell you that after 3 weeks, I'm here to tell you that this stuff works. It's been amazing so far.
All right, Lan, congratulations, and we're going to continue to strengthen those knees and get you walking more. All right?
Right on.